I decided to become an internal medicine doctor because I wanted to be able to develop a long-lasting and more of a meaningful relationship with people rather than just seeing them for, one problem and then not seeing them again. I like preventative health care. I feel like I'm too young or too early to really have a specific topic or focus yet, but so far I just really like doing preventative things to make sure people are healthy before anything bad happens and going that route. My approach to patient care is to have it more of a relationship between me and the patient so that we can openly discuss things and they can come in and ask questions without feeling like I'm just going to ignore them or blow them off, and to then be able to discuss things with them in a way that they understand so that they just feel comfortable with me. So I decided to join Esse because I really like the people here at the office and the company overall. I like their message as far as putting the people and the patients first and trying to take care of them before their diseases progress to a level where we can't go back. And overall, I just liked their attitude in the work environment. I would like them to write down all their questions that they have, because inevitably when they get here they're going to forget. And also to bring all your medications. If you have a copy of your old records, that's very helpful. If not, we can always obtain that after the fact. But those things are pretty good starting off place. I think communication is very important. I think that I need to be able to communicate in layman's terms with my patients so they can understand what their actual disease process is and how it's going to affect them in their life. And they need to be able to communicate with me about what their fears are, what their concerns are, and not feel like threatened if they have a question and that they can come to me openly and ask me. I also think it's important that they feel comfortable enough to challenge me now with the day of the internet, that they can read online and try to figure out what's going on with them. A lot of times that is not necessarily the case, but I think it's a good conversation to discuss why I think what I think is going on and why I think it's great when people go online. I usually joke with them and say, "Oh, did you go to WebMD and find out what was wrong with you?" And they usually say, "Yeah, it told me I had cancer." And so then it lightens the mood a little bit, and I tell them it's good for them to go online and to be educated about their own health matters, but perhaps this is more of a more reasonable diagnosis, and that feel free to look that up as well. And if they had any more questions or concerns, then they certainly could ask me.
Awesome, I think that's good.
Sure. You can come talk with me. I like meeting people. We can chat, see if you like me. If you don't, then, like I said before, go ahead and try someone else out. It's your health, which is the most important thing. So if I'm not going to be the right person for you, then you should find someone else that will. My husband and I, we decided to stay in St. Louis primarily because we wanted to raise our family here. Our families are both from here, so we have a large support group here. We love the area. I like what it has to offer. I'm familiar with it. I like it. I like the feel of it, and we're just very happy here overall. And where else can you ask? Where did you go to high school? Right now I would be chasing around my 18-month-old daughter. She tends to throw the whole pantry out onto the kitchen floor, so I like to pick that up repeatedly and try to keep her in line. Other than that, we'll go for walks with the dogs, play in the backyard, go to dinner, movies, and just kind of hang out. Pretty low-key.